Vigilance on concussions has been unavoidable for those on the field and close to the game. In a vacuum, no one would dispute the importance of adhering to strict medical protocols, especially when brain trauma is involved. But with the cloak of anonymity and the pressure to win, and an athletic future seen possible through on-field success, that sober public concern collides with more personal interests. ESPN, the magazine's Concussion Confidential, surveyed 600 individuals, 300 high school players, 100 coaches, 100 parents, and 100 athletic trainers, and asked the questions that privately reveal the crux of the continuing concussion crisis. When asked to rate their level of concern about concussions on a scale of 1 to 4, the lowest number being the most concerned, the highest number the least concerned, not surprisingly, trainers showed the most concern, followed closely by parents and then coaches, with a huge gap between those groups and high school players, who show an overwhelming lack of concern. When presented with a real-life decision on a concussion, again, high school players broke drastically from the other groups. If a player complains of a headache during a game, should he be allowed to return to that game? Less than a quarter of parents say yes, and less than 30% of trainers as well, with 1/3 of coaches. But well more than half of the players, 55%, say let a player with a headache continue to play. Another scenario. Your team is in the state title game, and your star gets a concussion. Would you rather lose the game as he sits out, or win it because he chose to play with a concussion? Here, only 2% of coaches said yes, and just 6% of parents, less than 10% of trainers. Yet again, more than half of the surveyed players, 54%, favored winning a championship game with a concussed teammate rather than losing with medical precautions sidelining that player. And finally, in an echo of the infamous survey that found elite athletes willing to take a drug that would kill them in 5 years in order to win Olympic gold, this question: is a good chance of playing in the NFL worth a decent chance of permanent brain damage? Trainers, parents, and coaches each overwhelmingly against this proposition. But again, the group which we've already seen would willingly win with a concussed teammate and allow players with headaches continue to play. High school players, to this question, say yes. Nearly 45% say a shot at a pro career is worth the risk of permanent brain injury from the game they love.